Dementia, Alzheimer's, we hear about that all day, every day. You know someone, everyone knows someone who has some form of dementia. Dementia is the umbrella term under which Alzheimer's, vascular dementia, frontotemporal dementia, dementia with Lewy bodies, Parkinson's disease dementia, progressive supranuclear palsy, and all of these medical terms all fall under dementia. Alzheimer's goes under dementia. Dementia is a symptom of Alzheimer's. So let's do some definitions. Definition of dementia is a mental illness that causes someone to be unable to think clearly or to understand what is real and what is not real. It's usually a progressive condition such as Alzheimer's disease, and I'll refer to Alzheimer's disease as AD from now on. It's marked by deteriorated cognitive functioning, often with emotional apathy. That just means they can't think like they used to, and they don't emotionally respond like they used to. The difference between dementia and Alzheimer's disease. True Alzheimer's disease begins at an early age, usually in your 50s or even earlier, while dementia typically occurs in the elderly. AD actually is just one of the many diseases that cause dementia. We used to hear it called hardening of the arteries, atherosclerosis, forgetfulness, Alzheimer's, just old age, senile dementia. All of these are listed under the term dementia. So what exactly is Alzheimer's disease? These are some terms that you may hear. Aphasia, that's the difficulty of coming up with words, or you substitute words for what you think you're saying, but it comes out totally different, and it may or may not be a known word. Apraxia, difficulty using utensils and tools, even apraxia, even using a pen to write your checks, or difficulty using the utensils to feed yourself, or a stylus on a computer. Agnosia, does not recognize familiar people, gets lost in familiar surroundings. And this is the one that typically people think of when they think of dementia or Alzheimer's. I want you to know that first and foremost, you must be an advocate for your loved one. Alzheimer's patients, even now in the U.S., are having chips put in under the skin. If they wander off, they can be found. Who wants your loved one to be lost? The next thing that's coming will be to chip every newborn when they're born. They started with the dogs, and it's going to the newborns, because who wants a missing child? Be an advocate for your loved one. It's coming it's already here. Executive dysfunction may be another term you hear. They can't manage the checkbook or use a computer. It's usually slow, but onset is progressive. The typical stages of AD is the early stage. It lasts about 2 to 4 years. It's the slowing down of the ability to think clearly. You start noticing some things are going on, but you're not real sure. Other people may notice it more than you do. Typically a spouse lives with them all the time, so they typically don't acknowledge that there's a slowing down of their thinking. By the time they get to the middle stage, it's usually from 2 to 10 years. They act differently, and someone needs to be with them at all times. And I'm going to go into some other things. The late stage usually lasts 1 to 3 years, and they need total care. The early symptoms of AD: misplaced keys, glasses, anything that they normally had a certain place for things to be located, now they can't find them, or they're not there, or they are there, but they forgot where that place is. They look up a recipe in a cookbook, but they can't remember how to follow the recipe. they start something and forget to finish it. That's not always Alzheimer's, otherwise I've got it. Have a hard time keeping up with tasks normally done every day in years past. Difficulty with numbers, paying bills, writing the correct amount on the check, signing the check, mailing the check. They may get it written, but forget to put it in the mail. They become very self-conscious because they know that something is wrong, and they're afraid that friends will notice and start asking questions. And you'll see them more and more withdraw from church and activities that they have always been a part of. Questions to ask the doctor if you notice some of these things in your loved one. What are some reasons for the changes I've seen? Not always are these changes going to be Alzheimer's or dementia. They may be chemical imbalance. Their sodium may be off, or their potassium, or they may have an infection. Just because they've got some of these symptoms doesn't necessarily mean that they've got Alzheimer's. So ask the doc, what are some of the reasons for the changes? What medicine helps with memory loss? This is a sticky comment. To be honest, there are a lot of medicine out there or several different medicines out there for Alzheimer's, but they maybe give you 6 months, and they don't do really much of anything, and they're very, very expensive. Now, if he suddenly gets Alzheimer's, I'm going to want everything I can to do for him to keep him as sane and logical for as long as I can. I understand why people take these Alzheimer's drugs. It's also okay if you don't. But that is a decision that you have to make. It may give you 6 more months. When your loved one has lost their ability to communicate, do you really want 6 more months? Just food for thought. Every decision is personal and your own choice. Is there help to pay for the medicine? Medicare will pay for some, but it's very, very expensive. Can they still stay alone? That's a question that you have to decide. Once they get to the point where they turn the stove burner on and forget to turn it off, or anything that is a danger to themselves, then it's time for them to no longer stay alone. I really encourage, if you begin to see some of these signs and symptoms, talk to them early and move them early, because the longer they have memories, the better and more content they will be. If you wait until the end when they can't stay alone and they don't know where they are, they have no frame of reference. If you move them in so late, it's even more confusing and exacerbates the symptoms. Is driving still safe? Probably not, and we talked about how to stop the driving. What services does my town have to help with care? And every town has a different facility, and I think Karen, she had to leave, is probably one of your best resources to go to for what's available in the community, for help for you and for them. Tips for keeping the home a safe place. Declutter. Declutter, declutter, declutter. I need to do that at my house. We've been in our house for 34 years. I dread the day we have to move and totally declutter. But don't have small things in and around that can be tripped over, knocked off. Declutter because you love them and you don't want them to get upset when they accidentally knock something off that you held precious. Label where things go, such as the glasses or keys. Put labels on things so that they can still read for a certain length of time. Increase the amount of light in the room. I did not know this, and I've just recently gotten some extra study on Alzheimer's, and I went and spent about 3 hours one afternoon with a gentleman in our church who's caring for his wife with Alzheimer's. She's in about her 10th year that they've been dealing with this. And I went over these things, these tips, and he said, yes, that's right, that's right, that's right. And he said, oh, I hadn't thought about that. I'll have to see if that does make a difference. Increase the amount of light in the room, because shadows in the corner look scary and they're fearful and they don't know, they don't understand what's going on, they don't understand what's over there, and they begin to hallucinate and have some things that make them more fearful. Remove or tack down any area rugs. As far as communication, turn off the TV or the radio when you're talking to them. Background noise and any other noise, this is for hard of hearing folks as well. Background noise interferes with your communication. When you talk to them, keep telling them what you want in short, simple sentences, but not childlike. Treat them with respect. They're not a child. Keep it short and simple, but not childlike. Be patient. Lots of patience. Give extra time for them to formulate their answers. There will come a time when they will not be able to get their answers out. But until they reach that point, give them time to get those words from their brain out of their mouth. It will come, but it may take some extra time. And show patience. Don't always try to finish their sentences for them. Let them work on getting those sentences out. Don't interrupt. If they cannot think of the right word for what they want, you can ask them to point to it. Remember, the changes in how they act are caused by brain damage. They cannot control how they act. It is part of the disease. It is not necessary to correct them and say, no, you don't do that. I told you yesterday that Joe Blow's not coming today. No, Joe Blow's not coming today. No, Joe Blow's not coming. How many times do I have to tell you Joe Blow's not coming today? Patience, answer over and over and over with the same tone of voice as though it were the first time that they had asked you. But you better be praying a whole lot that God will give you that grace. How can we as a church family help the family with Alzheimer's? It is teamwork. Teamwork as a church family. We can spend time with all the family. Shop and cook meals with them to put in the freezer, but be sure to clean up afterwards if you go and help them. I know that we have 2 or 3 in our church family where the husband is caring for the wife who has Alzheimer's. I don't know many husbands that like to cook. Some do, but not all. So shop and cook meals with them to put in the freezer. Take to doctor visits to get hair done or other errands. Small housekeeping duties. There again, when you're dealing with a family that has Alzheimer's disease in the family, it's a matter of pride. I can do it all, or I don't want anybody to see the mess I've let this house get into. So don't make it a big deal. Just go over and say, if you see a load of laundry there, just start folding while you're talking to them. If you see some dishes in the sink, just start washing them while you're talking to them. Don't make a big deal out of it. As far as, let's see, I don't have this down the slide, but for those that have Alzheimer's, couple of things they said. If their appetite is decreased, you put the food on a white plate. You set the white plate on a placemat that has pretty flowers on it, or polka dots, or chevron pattern. They start picking at the dots or the flowers on the placemat, because that's what they see. The food on the plate, on the white plate, is white mashed potatoes, white chicken, and green beans. Now, they'll eat the green beans because they can see them. They can't really see the mashed potatoes and the chicken. The colors all blend in together and they don't see it. So get Fiesta ware or something that's colorful where if you put white food on it, they'll be able to see it and they'll eat better. Have a placemat that's solid with no flowers or dots or things to distract. I never really knew this, and I talked with the gentleman I spent a couple hours with, and he said, you know, maybe that's why she's not been eating. And I've seen her picking at stuff, and so he's going to try it. Focus on the positive things, not the things they're not remembering. Don't ever ask, do you remember so-and-so? Or when a visitor walks in, do you remember Valerie? She's been here every couple of weeks. No, they won't remember. Just say, this is Valerie. She was here last week and she's come again today. Isn't that exciting? Keep it happy, keep it positive, keep it upbeat. Laughter is great. Keep your visits when you go to the family short but frequent. They are homebound. The loved one that's caring for an Alzheimer's spouse or family member, remember they are just as homebound as the Alzheimer's patient. Introduce yourself every time you see them as though it was the first time meeting them. They're not going to remember, or they'll get frustrated because they know they should know you, but they can't quite put the name with the face. Do not correct an incorrect statement. There's no need. They're not going to remember the next time they say something. Understand the caregiver will become just as homebound as the person with Alzheimer's disease or dementia. Love and care for both. Galatians 6:2, bear ye one another's burdens and so fulfill the law of Christ. There's a lot to be said about dementia and Alzheimer's, and it's difficult caring for those as we see them deteriorate, and you lose a little more of them each day. It's almost a slow, painful death to see this. Remember that it's you that it's affecting, not them. And if your attitude is one of sadness and depression, then they'll get sad and depressed and they don't know what's going on. They don't remember what's going on. But if you have an upbeat, happy, laughing, joyous countenance, they will have joy and laughter from day to day. And your attitude will affect their attitude. And they won't remember who they were before. They'll just know that this is a happy place.